Okay, so this is the treatment for cervical spine. The first thing is naturopathic principle. Make sure to kind of have that in your head in order to treat the patient. For example, if the patient comes in, even though they have neck pain, how do you know it's coming from the neck? So if there's somebody having a neck pain, that could be coming from it could be from the head, it could be from the upper body. We don't know. So this is the kind of part number one, find the cause. Find the cause. The part of the symptom is just a symptom. So don't follow, you can follow and chase the symptom. To treat it, you can always use painkiller. So you can use painkiller because if somebody having a pain, symptom relief. That's how the MDs, DO, right, nurse practitioner, PA, those are how they practice. How we do is try to find the cause. So try to find the cause any way you can do to try to figure it out. So number one is to rule out the red flag. So make sure, rule out the red flag that pain is not coming from the head, because anything on the head could be a red flag. So we also talk about upper motor neuron lesion. So in order to need to rule out, like you can do the Hoffman, you can do the Babinski. Okay, these are all the things that we'll talk about in a weekly class. We'll talk about a weekly class. Now let's focus on the treatment part of it. So let's kind of erase this. Yeah. So let's erase this. So I just want to make sure that when we talk about the treatment, we want to always think about the principles, right? Try to find the cause. So if somebody is coming in the pain on the neck, what it would be like, rule out the red flag. We talk about the red flag. So we talk about 1, 2, 3, 4, 5. I want you to kind of think about what is those red flags. Once you rule out the red flag, so these are possibly diagnostic imaging or referral, right? Now, we are thinking about common diagnosis, right? Part of the DDX. What will be on the DDX? It could be a muscle, right? It could be a muscle issue, muscle spasm. It could be on a facet. It could be on the disc, but not like upper motor neuron lesion disc. So these are kind of disc issue pathology that you can treat in your office. And then facet can also go to more osteoarthritis, so spondylosis, right? Degeneration on the changes. These are the kind of common things. It could be now, you can go in the fascia issue, right? So it could be few more that you can kind of adding on, but these are the common diagnoses. Number one here is on the treatment. You need to think about the timing. So timing of, is it acute or getting to the chronic? Why does this matter? Acute, what is the acute pain? What does it cause you? It tends to be caused by the inflammation. So we need to think about it, why there's an inflammation. Is it a tear or tear on the tissue? Or repetitive motion? Something is causing the inflammation. So you need to think about, oh, how can we decrease the inflammation if it is in the acute phase? So again, you want to kind of do like a determinants of health. So you can change in the diet, like a lifestyle, right? Why would we talk about the lifestyle? Why? Because when the inflammation is up, what does it goes, like what your body, how are you going to decrease the inflammation? You're going to use the endogenous, cortisol, right? That's the steroid. So when somebody's in the pain, your adrenal gland is up. That's how you basically, your body is trying to shut it off, right? Shut off, try to bring the inflammation down. That's why I talk about the lifestyle, is that you need to bring the stress down. If you keep having a stress is up, your adrenal, the pain is up, everything's up, and it's not going to help for the pain part of it. If you have this lifestyle, bring the stress down, also help the sleep. Why? What's going on the sleep? Because sleep is linking with the nervous system, right? So why this nervous system is involved? When somebody's in the pain with the inflammation, which nervous system? Is it a sympathetic or parasympathetic? they're not going to be restful. They're going to be more sympathetic dominant. That's also related to the adrenal. So you need to make sure to think about, okay, are they sleeping well? This is naturopathic. Naturopathic. Why we treat somebody coming in acute neck pain, why do we treat the sleep? Because there's a strong connection in the nervous system and there's an endocrine system. We treat the whole person. Treat whole person. Please make sure to kind of be different from other practitioners that why we do the way we do things. So think about the acute. Okay, you can do, if the determinants of health is not really changing it, you can do the herbs. You can do the turmeric, you can do curcumin, you can SPM, you can do a few other herbs, or many are different in the supplements. So supplements part of the SPM. SPM was more on the supplements rather than the herbs. So you can kind of think about other way, and then the supplement, you can do the fish oil, right? All the things that you can add on to it. And then if this doesn't help, then you can do the drug, right? So you can do the drug, you can do the ibuprofen, right? And then diclofenac, you can do medrospac, this is a steroid. So these are like all different. Why we lay this way? What's this? First, do no harm. So first, do no harm to the high force, right? This is another principle. We started from the first, do no harm. If it doesn't help, then we tend to do with a higher force. However, though, there is in the case in the acute, we'll talk about it in this like a disc pathology. So there's a disc pathology that it's really, really bad pain. So people talk about acute disc, really, really bad. So you need to draw the line here on the acute disc. If somebody having muscle weakness or wasting, you need to refer them out. But then here, acute disc, but they're not having muscle weakness and all that. So the deep tendon reflex. The tendon reflex was still like, 3 out of 5. Okay, so you can treat them in your office, but then it's pretty bad. Then sometimes you can straight to the medrospac, the steroid, because everything else not going to touch it. So you need to kind of think about that when I do prescribe medrospac, I also tell the patient to do fasting. So the juice, not than juice, maybe water, or intermittent fasting, more on intermittent fasting, or metagenics. Metagenic have some of the ultra inflamax, or there's orthomolecular. Orthomolecular has core inflam. Those are kind of powder that you can replace. I don't usually like to say, when I say the fasting, I should say more intermittent fasting or replacement. Do that with the medrospac and see. But medrospac is short. So sometimes you can only attend like 12 days or so. So then what are you going to do? You're going to increase the dose and you're going to decrease it. And then a lot of times I'll switch it to almost like a diclofenac. But then if the patient is okay without using that, I would make sure to go into the fish oil and SPM or turmeric. I would just do the turmeric like 2 grams a day, fish oil 2 grams a day, and just kind of high dose, kind of dose it up. But all these are, you do this first. So that's for on the acute. This concept on the treating acute is you can use it not only for the neck and lower back, any other parts of the body. Now, the problem getting into the chronic. Getting the chronic, they are past, so that past inflammation phase. So it could be on the 3 month, or it could be on the 6 month, or it could be in the years. If that time is already passed, the inflammation mechanism, pain signal, and the repair signals, a lot of the repair signal goes down, and it's more on the pain signal kind of comes up. That's why there's a lot of swelling. There is residual tissues that it's not healing up. So what we're gonna do is that we're gonna kind of think about, okay, in the chronic case, what is the cause of it? Is it still like a repetitive motion, or is it a degeneration? Degeneration happens because of the repetitive motion. Why repetitive motion happens? Also, the joint integrity. So if we talk about hypo or hypermobile joints, these are kind of important to kind of really think about. The part of the also on the cause it's just simply gravity. Gravity could be like a gravity weight, the body weight. So especially on the knee, even on the neck too. So on the cervical spine, and then the way lifestyle. Cervical spine jogging. Ask somebody to go run. If somebody having a disc pathology, with a weight, with a continuously jogging, with the lifestyle and the exercise, it's gonna make it way worse. So you need to change the lifestyle, because constant with the gravity and how much of the weight of the head is, it's gonna actually cause more repetitive motion or more irritation. Basically, like on the chronic part of it, basically irritation or inflammation continuously just on and on and on. So we need to stop that, and then we need to kind of return it. So repetitive motion, just kind of educate. So educate. Okay. So doctor as a teacher, make sure to educate, like a lifestyle or the posture, right? So posture, workstation, what you need to do, right? Degeneration part of it right here, and the joint laxity. Hypo, you just need to manipulate. Manipulation, find the manipulation. But how are you going to do the manipulation though? Why naturopathic manipulation is different. Naturopathic manipulation includes soft tissue. Soft tissue, so include the soft tissue, not only the muscle, you could include the fascia, you could include the nerve, you could really get all the tissue that is included in the soft tissue manipulation that you need to do. Then you do the joint manipulation. So make sure to think about when you do the manipulation, it's not, oh, I find the restriction and just manipulate. You need to really think about the surrounding tissue. And then hypermobile, if you find it, then you might need to do some therapy to injection to stabilize it, This could be prolotherapy, it could be a PRP. Some people going to the mono stem cell to do the regeneration. But you need to think about it. What is the cause of it? Gravity and the weight. So on the cervical spine or any spine, the gravity is so you need to tell the patient with exercise, get into the water exercise, and then do the traction. You got to do a lot of traction to go against the gravity. Go against gravity, and then on top of this, all the acute stuff will apply. There's an acute, then there's a chronic. So don't just gonna do this, you gotta do all the acute stuff in order to treat the chronic condition. So just don't forget though, you gotta include all this on top of that. So this is just the kind of beginning. We can kind of talk more about it, but this can apply for most of the tissue damage, not only the cervical spine. I think this is cervical spine, thoracic spine, and the lumbar spine. This will be a kind of good tip. One of the things that we can kind of next will have our colleagues do is just quickly show the video on cervical traction and lumbar traction. We have a portable one, we have a mechanical one, and we have an inversion table. Yeah.
Okay, so one of the things that we wanted to show you guys was our traction table. So we can use this Triton traction table to do both lumbar traction and cervical traction. The way that we would set them up for lumbar traction is we basically would strap them into here and here. That would stabilize the thoracic area, the upper body, and then this one going around the hips. And then what happens is we then attach this apparatus around their waist, and then this machine will pull their lumbar spine back towards the machine, slowly gearing up the weights. and so it'll kind of just create space in here. The other one that we can do is we do the same thing for the cervical spine. So in this case, we would raise the table up. We attach and then as it pulls, it just moves their head up like this. So this would be attaching basically into like the mastoid process area, and then just creating space in that cervical spine. Okay. So another way that we can do lumbar traction is with the Saunders portable unit here, so you don't have to have that big whole apparatus there. What you would do is the same thing. You strap in the upper body up here, and then you strap in the lower body here, not the lower body, but around basically the hips here. And you have the head up here. What's going to happen is as I pump this up, it's using a pump system, it's going to pull the lower part down this way. So I'll show you what that looks like real quick. So just watching down here, you can see as I pump that up, it's going to just move it down a little bit. We hold that for about 20 seconds, and then we release it. It's going to slowly go back down. You do that kind of pump, hold, and release. Do that cycle 4 to 5 times. Very similarly.
3.
Okay, so the other option for doing cervical traction is another portable Saunders unit here. So it's going to be the same system where you basically have their head in here, mastoid process area, and then I'm going to pump it up and it's going to slowly elongate. This is going to raise up here. Hold that for like 20 seconds or so, and then we'll let it go back down. We'll do that 4 to 5 times. So that's what this will look like with this. Hold that for a bit, and then release, and it slowly goes back down.